everyone. Today we are going to break down hepatitis B. It's a viral infection that affects the liver in the simplest way possible. Let's start with what it is and how it spreads, what happens in the body, and how we diagnose and treat and prevent it. So, what is hepatitis B? Hepatitis B is caused by the hepatitis B virus, HBV. It mainly attacks the liver, leading to inflammation and sometimes long-term liver damage. So how does it spread? So the virus spreads through the body fluid and could be through, just remember these three routes. It could be through unprotected contact, or through blood, needles, or transfusion, and it could be from mother to the baby. So let's add a fun fact. So most adults recover fully, but infants born with hepatitis B virus often develop chronic infections. So let's move on to incubation period. Incubation period is after the infection. It takes 1 to 6 months before symptoms appear. Most people have mild to no symptoms, but some may feel fatigue or even nausea, loss of appetite, and yellowing of the eye, also jaundice. So in acute phase, it's usually self-limiting, short-term infection lasting a few weeks to months. So most adults recover completely. In chronic phase, when the virus stays more than 6 months, which is common in babies and in about 90% and 5% in adults. So it can lead to cirrhosis and or liver cancer, which is hepatocellular carcinoma. So how can we diagnose hepatitis B? So we use blood test. Just remember 3 key markers. Surface antigen, which is infection, that indicates that infection is present, and surface antibody, which is recovery or vaccinated, and which is core antibody, past or current infection, it indicates. So if surface antigen stays positive for more than 6 months, it indicates that there is chronic hepatitis B. So we also check viral load and ALT for liver inflammation. So let's move to the treatment. We have acute hepatitis B, usually self-limiting, and usually treatment would be supportive care. They need rest or hydration. In chronic, usually it's a long-term treatment to reduce viral replication. The common drugs that are used are tenofovir and entecavir. So liver transplant is usually indicated in severe liver failure. When this severe liver failure happens. So let's move to prevention. So for all age group, we use vaccine, recombinant hepatitis B vaccine. For newborn who has HBs antigen positive mothers, they should receive this vaccine plus HBV immunoglobulin within 12 hours of birth. So post-exposure prophylaxis for anyone exposed or and vaccinated. So we should remember that hepatitis B is preventable. Through vaccinations or safe practices and awareness can prevent you and the others. So if you find this helpful, please do subscribe and invite your friends for more quick medical breakdowns. Thank you so much.